Hi, I'm Miranda Henry with Wound Source, and with me today is Dr. Rebecca Bryan, who's the Director of Community Outreach and Professional Development at Rutgers University School of Nursing, Camden. Thank you for joining me today, Dr. Bryan.
You're welcome. I'm excited to be here.
Great. Now, Dr. Bryan and Dr. Janice Bites will be speaking at the upcoming WoundCon Spring Virtual Wound Care Conference on March 12th during the opening keynote, The Impact of Adverse Childhood Experiences on Wound Healing. Now, Dr. Bryan, can you tell us more about what you and Dr. Bites will be discussing in the session?
Sure. Since the 1990s, research has increasingly demonstrated that what happens in childhood, experiences both good and bad, actually are embodied into our genetics and brain development and immune and hormonal systems, and they influence our health and our well-being and social consequences across the entire lifespan. And so as neuroscience has improved, as epigenetic science has improved, biologic plausibility has also increasingly been demonstrated. So it's fascinating to visit with that and to see intersections with that and with wound care.
Interesting. Now, who should attend this session, Dr. Bryan?
Honestly, I think everyone. I'm sure everyone's biased that way, but this is having a profound impact. This awareness. There's actually an entire movement across the United States, and I would argue globally, to recognize childhood trauma as being an unrecognized public epidemic. And the fact is that we are able to do things about it. It's preventable largely, and it also is treatable. It's possible to heal from it as well. And so across social sectors, this is being taught, whether it's medicine or therapies or law enforcement, social work, you name it. You can gain perspective by learning about this science. And what it ends up doing is it ends up shifting your paradigm, the way you view patients, and it increases empathy and compassion. So I would say really anybody could benefit from hearing this.
That's great. Now, what's one important takeaway that attendees will gain by attending this session?
So I think the biggest insight that Dr. Bites and I have gotten, we wrote a literature review in 2019, and we were able to demonstrate how risk factors that are caused by adverse childhood experiences overlap very significantly with risk factors for wound generation and wound healing. So you wouldn't think right away that what happens in childhood puts you at risk of developing wounds as an adult, but actually that's very true. And if you have a lot of childhood adversity, you will have a more difficult time healing. And I think this is beginning to show us why, which is going to lead hopefully to improved treatments and approaches with patients.
Oh, fascinating. Thank you so much, Dr. Bryan. And
you're very welcome.
March 12th at 8 a.m. Eastern Standard Time. If you're not registered already, WoundCon Spring is open and free to healthcare professionals like you. You can earn up to 13.75 free continuing medical education credits by attending, and will gain access to exclusive education, live networking, an interactive exhibit hall, and much, much more. So visit woundcon.com to register today. We look forward to seeing you virtually on March 12th.